Hello and welcome. I would like to start by thanking you for considering us for your procedures. The purpose of this video is to give you a guideline that will help you to better prepare for surgery. When you run a marathon, you simply do not wake up and do it. You train and get ready for it. We will help you prepare methodically for your surgery. Please pay attention to the timeline that we'll describe in this presentation. The first step is to start thinking about your goals and outcomes that you would like to achieve with your surgery. Let's be straightforward. We need you to be in good medical condition in preparation for your elective surgery. If you have medical conditions such as hypertension, diabetes, or anemia, they need to be under control. Your labs should be normal, and your weight should be stable and close to ideal. Patients with a BMI less than 30 usually have better outcomes. The heavier that you are, the more procedures that we will need to do. On your preoperative evaluation, you will be tested for nicotine, drugs, and pregnancy. Make sure that you do a urine test for all the things listed here to make sure that your surgery is not canceled the day of your procedure. If you suffer from anemia or low hemoglobin, you should start taking iron, vitamin B12 shots, and folic acid. You should also have a hematology consult to diagnose and treat the reasons for your anemia. Stop smoking. Let me repeat it. Stop smoking. Smoking decreases the amount of oxygen that goes to the tissues and is going to disrupt the healing of them. Do not smoke 4 weeks prior to your surgery and 4 weeks after your surgery. This includes cigarettes, marijuana, and hookah. You will undergo a urine test that must be negative, especially for open cases that include tummy tucks and breast lifts. You will be canceled if this test is positive. Please do not smoke. Blood thinners increase the bleeding risk after your surgery. Do not use blood thinners such as aspirin, heparin, Lovenox, Coumadin, or Xarelto as the most frequent ones. Ask your doctor about the safety of stopping these medications based on your specific condition. I encourage you to get closer to the ideal body weight. The thicker the skin, the less skin I will be able to remove. During surgery, I can remove between 1 to 8 pounds. This is obviously not a weight loss surgery. You cannot expect to have a body 20 or 30 pounds lighter with this surgery. On the same token, losing more than 15 to 20 pounds after surgery will result in flabby skin in the future. Once you know that you are ready for your surgery, book your surgery day. You have 1 month to complete your preparative labs, medical clearances, your trip and stay, and the postoperative appointments. Let's start with your labs. In order to make sure that all your organ systems are in order, we need to assess them with the blood work listed here. A urine analysis will also be needed. Your heart function will be assessed with an electrocardiogram. If abnormal, a stress test, an echocardiogram, and a cardiac clearance is going to be needed. Finally, if you are having a breast procedure, a mammogram or an ultrasound will be requested. If you have any medical condition or an abnormal lab, we will request you to have a medical clearance. If you suffer from anemia or increased bleeding times, a hematology consult will be needed. Thyroid or diabetes issues will require an endocrine doctor. An abnormal EKG will require a stress test and a cardiology clearance. Finally, if you have chronic pain, you need to coordinate with your provider to adjust your current pain regimen. 1 month prior to your surgery, you should stop some medications that might increase your risk for anesthesia or complications after surgery. This includes amphetamines, oral contraceptives, hormone replacement, or hormones for gender reassignment. You need to schedule your post-surgical management appointments. Drain removal should be done by a nurse or a primary care physician. Patients undergoing liposuction, tummy tucks, breast reduction or lifts will have drains that may need to stay between 1 to 4 weeks. It is very important that this is clear before your surgery. Otherwise, we'll be happy to be taking care of them at our surgery center. Planning is of the essence. Lymphatic massages and fluid drainage is very important after surgery. Make sure that you schedule between 20 to 30 massages after your liposuction. For other procedures where I do cutting of the skin, I like to wait 1 month before undergoing any massages to prevent damage to the suture lines. Let's start planning your trip and stay 1 month prior to your surgery. Book your flight and get a cancellation insurance just in case that the weather doesn't permit undergoing your surgery or you have a medical issue that will prevent you from having it. Also book your recovery house and bring a companion. Now let's discuss what we need to do 2 days prior to your surgery. Now let's talk about the arrival and departure after your surgery. You should arrive 1 to 2 days prior to your surgery date. The length of stay will depend on the procedure. For a breast augmentation, around 3 days, breast lift or tummy tuck 5 to 7 days, lipo HD or BBL 5 to 7 days, eyelid surgery around 3 days for the upper eyelids, and eyelid surgery of the lower eyelids or nose surgery between 5 to 7 days. 2 days before your surgery, we need to start a skin preparation by using chlorhexidine soap, also known as Hibiclins. I will encourage you to start a full liquid diet 2 days prior to your surgery, especially for abdominal surgery. This will decrease the bowel contents and it will favor the surgical outcome. In addition, milk of magnesia will help cleanse your intestine. Do it gently to prevent massive diarrhea. It is very important that you remain well hydrated. Also, 2 days before your surgery, it's very important that you acquire some supplies in preparation for your dressing changes. Feminine pads are ultra absorbent, cheap, and very simple to use. Now things are getting real. It is just 1 day before your surgery. Let's explore what are the things that you need to do before this amazing day. Let's talk about the diet and medications the day before your surgery. Drink 8 glasses of water throughout the day to keep hydrated. Do not eat or drink after midnight. That includes water. Medication-wise, I will encourage you to take Tylenol 500 milligrams every 6 hours starting the day prior to your surgery. Now let's talk about what not to wear the day of your surgery. These include wigs, fake eyelashes, and contact lenses. Dark nail polish, acrylic nails, or gel nails need to be removed, especially to the index and middle fingers. Don't bring any jewelry and remove all your piercing. These are some of the things to wear the day of your surgery. A new bathrobe to keep warm, pair of slippers, and a comfortable dress. I know it has been a long road, but finally the day of your surgery is here. Let's talk about what to do and what not to do during this day. 2 hours prior to your surgery, I will encourage you to take your usual medications and Tylenol 500 milligrams tablets with a small sip of water. Please hold your diabetes medications. Prior to coming to the surgery center, take a good shower with antibacterial soap. This will cleanse the skin that we're going to be cutting through. In addition, do not use any body lotion. That will disrupt the markings that we need to do in preparation for your surgery. Also, don't use any makeup. I promise you, it's going to get ruined by the end of the surgery. You will have dressings after your surgery. This includes ABDs, ACE wraps, and/or a binder. In some cases, we'll use a faja, especially for liposuctions and Brazilian butt lifts. Drains will be used if major tissue mobilization, such as tummy tucks and breast lifts. If there is an increase of bleeding during surgery, will require also the use of these devices. The duration is between 1 to 4 weeks. Expect going home with them, especially if we do great cutting of the tissues. Pain-wise, most of the patients have a moderate level of pain. Usually they describe it as a working out pain. The score is between 5 to 7 over 10. However, it is well controlled with pain medications by mouth. We'll give you the specific regimen the day of your surgery. Here you can appreciate the pain management that I like to use with my patients. You will have Tylenol 650 milligrams at 9, at 3, at 9, and at 3. Ibuprofen 400 milligrams at 6, at 12, at 6, and at 12. Basically, every 3 hours you're taking a different pill to try to be ahead of the pain. You'll have access to narcotics, including oxycodone or Norco. Notice that the Norco has also Tylenol. In this case, you will only take 325 milligrams of Tylenol if you are combining it with Norco. I like to use Valium because it's a good muscle relaxer. This is good for patients that undergo tummy tucks and breast augmentations. One typical question is what to eat after surgery. Eat light food. After anesthesia, you will feel a little bit nauseous. Don't try to eat very greasy, salty, or sugary. After surgery, you will go home or to your recovery house. I encourage you to walk to prevent clots that can form in your legs and travel to your lungs. To avoid pneumonia, I will encourage you to use an incentive spirometer as shown here. Basically, take deep breaths 10 times every hour. That will help expanding the lungs and preventing this complication. You will have a follow-up appointment with our nurses the day after surgery and the day prior to your trip back to your city of origin. Now let's talk about some frequent questions after your surgery. The time of work is between 1 to 3 weeks, depending on your job description. You will feel 80% normal by 6 weeks. After your surgery, you are encouraged to walk to try to prevent clots in your legs. Please do not lift heavy. In the first 3 weeks, you need to lift less than 5 pounds. Between 3 to 6 weeks, up to 10 pounds. You might get back to normal after 6 weeks. You can shower 1 week after your surgery. However, you're encouraged to do sponge bathing until that. How to avoid infections. Do not use a cloth on your wounds. This might carry some bacteria that might affect your healing. We'll encourage you to use antibacterial gel soap as shown here. If you have drains, we'll encourage you to use peroxide to the entrance point of the drain to try to kill bacteria. Finally, when you dry up, use a dry, clean cloth to avoid contamination. When can I drive again? When you are off narcotics. If not, you will be considered DUI. Usually it takes between 1 to 2 weeks, but it varies by procedure. I hope that this video was informative and that helped you understand better the details related to your procedure. If you have any further questions, please do not hesitate to contact us. I'm looking forward to participate on your transformation. Thank you again for considering us for your surgery.